We're here to do the adult physical assessment today on our patient here. This is Heidi Voss. I'm going to do the head, eyes, ears, nose, and throat, mouth exam first, and the neck. First, we're going to look at the head. We're going to be inspecting the head. We're going to look at his hair, face. We're going to look for any lesions, those kinds of things on the face. We're going to look at cranial nerves 5 and 7. At this time, I'm going to ask you to raise your eyebrows, and I'm going to go ahead and ask you to puff out your cheeks. Good. Can you feel both sides the same?
Yes.
Okay. I'm also going to go ahead and palpate sinuses, check for any tenderness, for any signs of sinus infection. We are going to look at the ears, which is cranial nerve 8. I'm going to inspect the ears, pull gently on the outside. You're going to look for patency. You're going to look for the color of the eardrum. Make sure it's pearly, white, shiny, and you can inspect both ears. At this time, we can also do the Weber-Rhine test to test for hearing. This is our tuning fork, and if we're going to hit it gently, tap it, see if you can hear it.
Yes.
And then you can put it on the back. You can do both ears, and then you put it on the back of the mastoid to see if you can feel that, and then hear that again. And the Weber, you're going to put it, tap it, put it on the top of the head, and see if they can hear it in both ears equally. Good. We're going to look at the eyes. We're going to test first the Snelling chart and chest for visual acuity. We can also do the Ishihara's exam, which is for color blindness. We're going to look at the eyes. We're going to look for the red reflex. We're going to look for the disc size, and also pupil response. Look straight ahead. And we're going to look for the red reflex. Okay. Good. And then for cranial nerve 2, I'm going to have you look straight ahead. Follow my finger. Okay. Good. The nose, we would inspect the nose. We're going to look for any tumors. We're going to look for patencies, we're going to look for polyps, anything that would be obstructing the nose. The mouth, we're going to look at cranial nerves 12, 10, and 9. We're going to look at the mucosa, see if it's moist, the throat, the size of the tonsils, the uvula, the condition of the teeth. And I'll have you open up, say ah. When they say ah, the uvula should rise and fall. And I'm going to have you stick out your tongue. Good, and back in. And then we're going to palpulated sinuses, sorry. Neck, we're going to look at the neck, we're going to look at his lymph nodes, see if there's any swelling, anything that's notable, any tenderness. We're going to be feeling the thyroid. I'm just going to pinch it, I'm going to have you swallow. Good. And again. Good. We're going to test for range of motion, which is cranial nerve 11. So I'm going to have you try to turn your head against my hand that way. Good. And the other way. Good. And over to the side and side. Good. I'm going to also listen to his carotids. We're going to be listening for a pulse, thrill, or bruit. Good. For respirations and respiratory system, we're going to be inspecting, palpating, and percussing. Respirations, we're going to look at the chest. We're going to look at symmetry, rise and fall with respiratory effort. We're going to look at breasts. Females, you would look at breast development. Males as well. You can look for any dimpling, puckering, any respiratory efforts that seem to be struggling when they're breathing. We're going to palpate nodes, which in the respiratory system are right under the armpit. Axilla and the supraclavicular, which are right up here. We're going to look for any tenderness or an enlargement. For respiratory system, you can also do percussion. So you're going to be testing for a dullness or a high-pitched full feeling. It'll be a change in sound, actually. You can look for tactile firmatitis, which is also in percussion when you're percussing. You can do bronchial. It goes along with auscultation as well. You can do bronchial, bronchiovesicular, and then vesicular is lower. So we're going to auscultate all areas of the respiratory system. Start with bronchial, deep breath. Good. Okay. And deep breath. We're going to move on to cardiac. Cardiac, we're going to look at rate, rhythm, and we're going to check for murmurs or bruits, which can be happening in the cardiac system. We're going to auscultate. You're going to auscultate the right base, the left base, the Erb's point, the tricuspid was right here. The apex is over here, and then right at the xiphoid. So you're going to auscultate all 6 points, and you're going to look for rate, rhythm. For cardiac, you can also palpate. So when you're palpating, what you're looking for is you're going to go over those same points and you're going to feel for any pulses or any thrills that you may feel, which may be an indication of possibly a murmur. When you're listening to the rhythm, you're going to listen for the lub-dub. The lub-dub or the lub-stub is indications for a murmur. We're also going to palpate for pulses. You can do radial pulses, you can do brachial pulses, carotid, and then you can also do femoral pulses, which we'll test for that. Peripheral pulses you can do the back of the leg and the top of the foot as well. GI, you're going to, for male or female, you're going to check the reproductive system. We're going to go ahead and pretend we did that. We are going to check for any lesions, abnormalities, those kinds of things. In females, you can check for C-section scars, male circumcision, anything like that. I'm going to ask you to lay down. I'll give you a nice pillow. You can keep your knees up if you want. So we're going to go ahead, that's okay.
It's gonna happen, I know it.
Okay, we're going to inspect and we're going to auscultate the abdomen. You're going to listen in all 4 quads. You're going to be listening for vowel sounds. And it's very important. You're going to have to sometimes listen for quite a while to get a vowel sound. You're going to hear a dull or a high-pitched or maybe no sound at all. You can also palpate for tenderness. Palpating in all 4 quads again. If you're going to look at the liver, for liver enlargement, you're going to look on the right side.